Well, thank you very much, Mark, and good afternoon, ladies and gentlemen. And first of all, say it's a real honour to actually follow on from Kate, and having heard her inspirational story, I think it really gives us a lot of food for thought as to what we're doing and what more can be done to work in this important area. I'm certainly delighted to be back again at this year's annual employment seminar. And I want to first of all thank David Babington on behalf of Action Mental Health for his kind invitation, and also the June Trust for their continued sponsorship of this very worthwhile event. And references made to Fred Shewan in terms of his civic role. He was actually a councillor in North Down Borough Council, one of my predecessors, so I hasten to add he wasn't one of my immediate predecessors, so there was a little bit of a gap in between. Last year's seminar focused on the topic of providing employment opportunities for people with mental ill health. And of course, this is still a challenge for all of us who are trying to improve the prospects of those who suffer from such conditions. And we've really had reference to the issue of the historic lack of placements in terms of the public sector. And I'm pleased to say that that is now a situation that is going to be changing over the months that come, and placements in the public sector, including those who have various disabilities or other ill health conditions, was actually one of the key themes in terms of the recent jobs economy initiative that was launched by the executive at the beginning of this month. So hopefully we will see substantial progress on that particular point in the very near future. However, the change in focus for this year's event is to those who are perhaps in employment and suffering from mental ill health, and it is particularly relevant. In fact, I would say that it's never been more timely to remind employers of their responsibility to people with a disability, and also to promote and offer the full range of support that is available, both to them as employers and of course to the employees themselves. Today's event provides a platform for reflection and discussion about mental health in the workplace. It allows us to hear what people can do to support themselves in the workplace, and what actions employers can take to ensure that everyone in their organisation has a chance to fulfil their potential. Last year I stated that employers need to be creative in their efforts to assist people to enter or to return to work while recovering from mental ill health. The very same applies to employers when it comes to keeping people at work. There is much support and assistance available to them from sources such as Action Mental Health and other disability organisations, as well as my own department. The consequences of not putting these supports in place is very stark. The individual starts to underperform, stress builds up, and this leads to a potentially long-term period of sick absence. So mental ill health is a very real and prevalent issue for us all, and my department, like others, is trying to address it on a number of fronts. Staff have access to welfare support, occupational health services, and an employee assistance scheme, as well as receiving internal training. They'll also have a number of staff who are on the Workable programme being supported by organisations such as Action Mental Health. But we need to do even more. It is the everyday management of people that is crucial, especially as a preventative measure. This is where personal and corporate resilience can play a real part in helping an organisation to manage this issue, and I look forward to hearing from some of the guest speakers on this topic. One thing I'm certain of is that officials from my own department are very keen to build on the close working relationships that they have with Action Mental Health and the many other organisations that work tirelessly to improve the employment prospects of people with a disability. Earlier I referred to the Workable programme, which Action Mental Health, as a leading partner of a strong consortium of local disability organisations, is contracted to deliver. Workable plays a vital role in helping people with a disability not only to obtain employment, but perhaps more significantly, supports them in the medium to long term while they are in employment. Through specialist services such as a dedicated job coach, training and education for the employer and colleagues of the Workable employee, Action Mental Health can make a real difference at times when workplace issues arise or the individual is struggling to cope with their condition. There are currently more than 70 people with a mental health condition being supported in employment through the Workable programme. In 2011, the Disability Employment Service, working in partnership with Action Mental Health and the Belfast Health and Social Care Trust, implemented a ring-fenced application and recruitment process which resulted in 7 people with mental ill health commencing employment with the Trust. This was a great example of innovative and collaborative working. 6 of those 7 recruits are still employed with the Belfast Trust, being supported by Action Mental Health through the department's Workable programme. More recently, my department introduced a new specialist disability employment programme entitled Work Connect. This programme, which will offer individually tailored pre-employment and short-term in-work support, will also be delivered by the Supported Employment Solutions Consortium, headed by Action Mental Health, in conjunction with the Cedar Foundation. I know that the Disability Employment Service has high hopes for the programme in helping people with mental ill health and other disabilities to find and retain suitable employment. Another issue that I am acutely aware of is the efforts of Action Mental Health to encourage more work placement opportunities for people within the public sector. I know that David has a further meeting recently with the Director of Corporate Human Resources in the Department of Finance and Personnel, and I believe that positive progress is being made. Officials from my department have also been in discussion with corporate HR to explore the options of how many new work placement schemes may be implemented and supported. I am very hopeful that a positive outcome will be arrived over the coming months. So on that rather positive and hopeful note for the future, I want to conclude by congratulating Action Mental Health for once again putting such an important issue forward as the theme of this year's seminar, and for challenging us all to play a more active role in helping and supporting people with mental and ill health to perform and prosper throughout their working life. Because it's always important that we remind ourselves that every single person in the society has their own particular skills, their own particular talents. And what we have to do is, first of all, put in place the measures to bring out those talents and to allow them to develop to the fore. And moreover, whenever people are facing difficulties that are limiting their ability to actually deploy their talents, it's critical that we then put in place the support mechanisms to address that. And through that, the individual will benefit, the employer will benefit, and indeed our economy and wider society will benefit. So thank you very much.